Well, the wide-scale looting at the Tembisa Hospital has left many South Africans with their jaws on the floor. And what the SIU believes some of these syndicates allegedly involved in that looting did, well, they splashed millions on luxury cars, wait, at least for a Bentley and even a boat. But that's not all, at least according to the SIU.
The Maumela syndicate refers to Hangwani Morgan Maumela. The SIU is reviewing 1,728 bundles worth 816 million related to the Maumela syndicate and has completed to date 924 analyses, uncovering significant irregularities. So the SIU has traced about 41 suppliers or service providers linked to this Maumela syndicate. 3 of the companies that were awarded contracts to the value of 13,538,292 in this syndicate are linked to Vusi Muzi Matlala. So this Vusi Muzi Matlala would have come in as part of the syndicate that, according to our evidence, is really led by this Maumela.
Well, the Mazibuko syndicate has also been identified linked to a Rudolph Mazibuko, which the SIU is gunning for assets.
The SIU reviewed, in this case, about 651 bundles, valued at more than 283 million. At the moment, 392 completed analysis revealing assets worth more than 42 million, including multiple properties in the Western Cape and Gauteng.
And Syndicate X?
The SIU is currently, with regard to this syndicate, assessing 1,237 procurement bundles to the value of more than 596 million linked to this syndicate. An analysis of 646 bundles have revealed numerous procurement fraud and irregularities, and the identification of secondary conduit accounts used to launder funds connected to the Tembisa Hospital.
But the repercussions of the illicit gains are hitting patients and residents here in Tembisa who rely on this facility for services say they're simply gobsmacked.
This man says at this point he does not even know if the hospital will have medication for his wife. He says his wife is ill.
At least
This resident says they rely on the Tembisa Hospital for help. And when things like this happen, they lose hope. She says this is all they have as a community.
And then included haholo bane ke rena mphakathi ba iloreng re use up like ra need ra itloka holo rona bile re le di pensioners oro gotse.
Well, nurses who spoke to the SABC on condition of anonymity tell a very sad tale. This nurse says it's a very painful situation. She says the hospital is falling apart. Nurses are in shortage and they work under very difficult conditions. She says that sometimes contracts even lapse due to a lack of money. But this is what is happening.
Ngapha kunemanesi lawamisilo yama-contract ukuthi yangasebenzi batshele ukuthi ama-contract ayephelile whereas imali kuthiwa beyikhona or ikhona yiyo le ndaba le isuka ezizwisa ubuhlungu njenge community njengemanese asebenzayo under pressure.
Yeah, I feel very bad because we nurses are working under severe conditions in this hospital. You find sometimes there are no linen, there are no medication, and these are the stuff that everything falls onto a nurse. Even if anything goes wrong, that's a nurse problem. But we have got a shortage of nurses. That is an old age problem that has been besetting the health profession.
Well, industry unions believe the rot goes much deeper, and the SIU should cast its investigations wider to other facilities in the province.
This corruption is widespread along many facilities in Gauteng province, and this is a confirmation of what organized labor, including the citizens of Gauteng, have been saying about the corruption, and including the situation in the health facilities. And this is taking a lot of funds from the public purse, which results in shortage of staff in many facilities within Gauteng. And definitely a comprehensive investigation can assist the department in dealing mostly with senior managers who are exposed, who are implicated in corruption.
Indeed, it came as a big shock that the actual amount actually has gone quite higher than what was expected. But as a matter of fact, NEHAW welcomes the investigation by the SIU, and as a matter of fact, NEHAW views corruption as something bad that society must get rid of. And as a matter of then, NEHAW believes that the law must take its course, and those that are found to be responsible for this must face the music.
While investigations continue into how this facility was stripped of billions in resources, it's the greater Tembisa community that continues to suffer. Chriselda, SABC News at the Tembisa Hospital.